Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Updated guidelines for standardization of biochemical indices for bone status. The Joint International Osteoporosis Foundation Working Group and the International Federation of Clinical Chemistry Committee on Bone Metabolism have published important updated guidelines for the correct use of biochemical indices of bone status. The guidelines are published in the journal Clinical Chemistry and Laboratory Medicine. The newly proposed term, bone status indices, offers a comprehensive framework to unify terminology and improve comparability across studies. Unlike previously used terms such as bone turnover markers or metabolic markers of bone turnover, which focuses on isolated aspects of bone metabolism, bone status indices provide a holistic representation of bone status and integrate a wider array of factors, including structural elements, metabolic byproducts, enzymes, and regulatory molecules. Exposure to red light linked to lower risk of blood clot. Humans and mice exposed to long wavelength red light and lower rates of blood clots that can cause heart attacks, lung damage and strokes, according to research published in the Journal of Thrombosis and Hemostasis. The findings, which need to be verified through clinical trials, have the potential to reduce blood clots in veins and arteries, which are leading causes of preventable death worldwide. The team exposed mice to 12 hours of either red, blue or white light followed by 12 hours of darkness in a 72-hour cycle. They then looked for differences in blood clots between the groups. The mice exposed to red light had nearly 5 times fewer clots than the mice exposed to blue or white light. Activity, sleep, eating, weight and body temperature remained the same between the groups. The team also analyzed existing data on more than 10,000 patients who had cataract surgery and received either conventional lenses that transmit the entire visible spectrum of light or blue light filtering lenses, which transmit about 50% less blue light. They discovered that cancer patients who received blue light filtering lenses had lower risk of blood clots compared to their counterparts with conventional lenses. This is especially notable because cancer patients have 9 times the risk of blood clots of non-cancer patients. Brain structure differences may influence disordered eating in young adults, study finds. More than half of 23-year-olds in a European study show restrictive, emotional or uncontrolled eating behaviors, according to a new research led by the Institute of Psychiatry, Psychology and Neuroscience at King's College London. Structural brain differences appear to play a role in the development of these eating habits. The study published in Nature Mental Health investigates the links between genetics, brain structure and disordered eating behaviors in young people. Researchers found that process of brain maturation, whereby the volume and thickness of the cortex decreases during adolescence, is a factor in whether teenagers develop restrictive or emotional uncontrolled eating behaviors in young adulthood. The researchers analyzed data from 996 adolescents in the Imagine longitudinal cohort in England, Ireland, France and Germany. Participants provided genetic data, completed questionnaires about their well-being and eating behaviors, and had an MRI scan at ages 14 and 23. At age 23, participants were categorized into 3 types of eating behaviors: healthy eaters 42%, restrictive eaters 33%, and emotional or uncontrolled eaters 25%. Clinical trial shows new tablet safe and more effective for elimination of intestinal worms. A new tablet combining albendazole and ivermectin is safe and more effective than albendazole alone in treating trichuris trichura and other soil-transmitted helminths (STH), according to a clinical trial conducted by the STOP Consortium. The findings, published in the Lancet Infectious Diseases, open opportunities to improve the control of these neglected tropical infections, which affect around 1.5 billion people worldwide. This fixed-dose co-formulation has several advantages. It is easy to administer as it is one single pill and does not require dose adjustments based on the child's weight, explains project leader Jose Munoz, IS Global Researcher and Head of the International Health Service at Hospital Clinic Barcelona. Also, we hope that combining 2 drugs with different mechanisms of action will reduce the risk of the parasite becoming drug resistant, he adds. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.